February 26, 2026. Board of Health meeting to order. If you will please stand with me as we cite the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic which stands one nation, under God, indivisible, with liberty and justice for all. Okay, so Laura, you are doing the roll call today.
Good morning. Yes, sir, I am.
And
Commissioner Hoffmaster.
here,
Commissioner Houts.
Here.
Commissioner Leininger.
here,
Commissioner Collins.
here,
And Commissioner Schaefer.
here.
Commissioner Stoll. Fantastic.
We have a forum. Next on our agenda is approval of the agenda. I move to approve the agenda as presented. There was a motion from Commissioner Hoffmaster, support from Commissioner Stoll to approve the agenda as presented. Any discussion? Hearing none, all those in favor say aye. Aye. All those opposed, motion carried. Next is the approval of the January 22nd, 2026 meeting minutes. Those are in our packet.
Make a motion to approve those minutes. Support.
I have a motion from Commissioner Stoll, support from Commissioner Schaefer to approve the January 22nd, 2026 meeting minutes as presented. Any discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. That brings us to item 2 on our agenda. Time where the public can address us. Public comment. Moving on, I think we have no public comment. Health officer report.
Good morning.
Good morning. Beautiful day out. Beautiful day.
It's a beautiful day.
It's gonna be a beautiful weekend. The water's gonna be running out of the tree.
Yeah, and hopefully not through our.
Out of the tree. Oh.
It's sad. Yeah.
Sugar water.
Oh my goodness. Okay. So our auditors have finished their work here and we will be seeing them next month for the audit report. And that will be probably first thing on the agenda. The accreditors that do Michigan's local public health accreditation will be here next week. It is finally here. We've been working on making sure that everything's as it should be for a year now. So we are excited to have them here. One of the items you have today for action is a request by the agency to modify our banking arrangements in St. Joseph County. We're using a bank there for deposit purposes. I'm going to take those funds and move them. St. Joe County and our Three Rivers area is not, it's different. We have different banking options and we want to consolidate. So that is for later on the agenda, that change. Also today you have an updated cost allocation plan. This really is the same plan. It's just modified and updated. It was reviewed by the committee and for your action today. Also the quality improvement plan for the agency, which expired in 2025, was updated and brought to the committee for your action. We do have an update on our senior Medicare patrol grant that we applied for. We were granted those funds, or at least a portion of them. And I'll let Laura talk more about that when it's time for her report. We do have up on our website a request for bids for an updated website. And those are not due yet. They're due early in March. The plan is to bring any proposals that we do bid before the finance committee and then for the employee to take action in March at the March meeting. The intent of the website redesign is to make it compliant with ADA requirements, and we're excited about the change. Also, our vendor has indicated the one we currently use that they are not going to do that. So we really don't have a choice. We need to move. So this is to all of this wrapped up into one package. We are making progress with our community health improvement plan, or at this point, we're still working on the community health needs assessment for the agency, but we are making some progress there. There was an effort in the city of Coldwater to bring RX kids, and I think you probably will know what that is at this point, to residents within the city of Coldwater. It didn't pass there, but I expect that if the public or the public money continues to be available, there may be further requests down the road. What we agreed to do as an agency was what we always do. Share the information about the program with our WIC clients, put it out on social media, attend education. So, but that didn't come to pass. So put them in, sure. We do have Board of Health Education today, and that is going to be presented by Megan Weinberg. She is a regional epidemiologist for Region 1, which Hillsdale is part of Region 1. Branch and St. George part of Region 5. She and Bethany are both our regional EPIs. They put together a presentation. We'll present it after the meeting today. As far as staffing updates go, we do have an immunization clinic clerk part-time position open in St. Joe County and an outreach specialist position for AAA open in Water. We continue to offer mobile services in Litchfield and Waldron. And then I took an opportunity to kind of talk a lot about measles and provide some information here about the change since the year 2000. We were seeing status in the United States for measles. I anticipate that's going to end probably this year. There's a group that meets in April to look at our cases and what's going on in the United States. And we have a lot of cases just since 2026 started. So as I was putting this together last week, we were upwards of 900 cases of measles in the United States, that's a lot of cases of measles. And not only are there consequences for some individuals that get measles immediately as they go through the course of the disease, but there can be lingering effects for years later based on what that virus did and stuck around while they were sick. So a lot of information here, a lot of references. Obviously, Dr. Lubarello is much better at speaking about measles than me, but I just couldn't not take the opportunity to talk about this increase in cases. And, we're just a month and a half in and already in cases of measles is huge. As far as our buildings go today, the only thing that we have business is that HVAC project bid at the Hillsdale building that the Finance Committee reviewed. And else is going right along. That's my report today.
Any questions for the health officer?
Wondering about the usage of our mobile. Do you track usage?
We are. So, we are putting together a plan to track it for the rest of this fiscal year, and then we're gonna make a decision. The plan is to make a decision at the end of the fiscal year. If it makes sense to continue holding.
Try that. Help there.
It's amazing to me that it isn't used more. So,
Yes.
Everybody talks about how bad we have it with transportation, but yet try to take services to them and sure. Commissioner Stoll, you had a comment.
Yeah, wondering about the ARCS Kids program. So at the city of Coldwater, they also trust County word about this.
sure.
And I believe when they came to us, maybe get some months. that we can look out. I see value in that program. That I think that more so from the standpoint that the public or other agencies want to support it, or foundation perhaps. So I see value to that. So when it says it did not succeed in a bid to come here.
Because, okay, so, to come on board with RX Kids, you needed at least a 1 year, the first year of financial commitment from the private side. The attempt was to have the city, fund that first year. And those elected leaders chose not to do that. The plan, as I understood it from the city attorney, was to seek additional private funds for years 2 and 3 after that. But, you know, we can, you know, it was a pretty tight window. It was kind of like, you know, this is an opportunity. Can you come up with, for them, for the city, only it's like $150,000-ish.
But I do, if it was being not, no funds are being added this next year with having a budget. And if they could try to.
Right. I understand that too. There was a few moving parts there, but yeah.
Yeah, I don't, mention that being in the state budget for the next fiscal year.
Sure, and there's always that risk, and I understand that, but I mean, what the kind of way it was phrased when it came to the county board is that county's commitment to use like our people and agency resources. And so that when I said something about that, I said, well, absolutely, I'm sure our agencies all about making this happen for the position county, but we're not going to funds to. Purpose. Just curious.
On our website right now, is that not, will it not read? So it's not, that's the part that's not ADA compliant, that it doesn't read
The search bar doesn't work very effectively. So if you put, for example, WIC in the search bar, you'll get something, but you're not gonna get some of the specific stuff like that. What is it? The posters like, or the flyers that are, they will not search those on.
It's not searching the pages as well as the documents. So when the search engine just brings up documents, it doesn't necessarily send you to the WIC page for that information. Additionally, again, there are some visibility issues that we currently don't meet that we need to meet. And
It's
then
the
the
age stuff.
right. So, so with the desire of our current vendor to discontinue service to us and our needs to meet the requirements under the Department of Justice ADA compliance, it's a good time for us revamping the entire site.
St. Joseph County's going through that right now as well, so Teresa might.
we're all gonna have to,
Might be good when you search hall match. That's
Well, they become very, they become very.
We look very similar.
heavy track.
Wins, what they.
Oh my goodness.
all right, any other questions for the health officer? Dr. Luke Morales, medical director,
Good morning.
good morning.
My report is in your packet. Not much new, except I'm looking forward to a 10th day at the Capitol in March. Several of us are going, and it's always been a good experience. I've gone the last few years and really enjoyed it. So we'll do that in mid-March. And I would comment on measles. It has a statistic in there about herd immunity, and if 95% or more people are immunized, then the rest of those 5% that are not immunized might be protected. And I don't know that I looked at the data like maybe last week for our measles, and I think Grant County was like 62% of kindergartners, and there was 70 of teenagers, and adults were dismal at 45. So, and some of us don't know, right? Like I need to go have mine checked because I'm in that age group. well, you know, did I get that MMR? Probably, but was it effective? I don't know because they revamped the vaccine. So, you know, if you don't know, talk to your provider and just get some titers and make sure. And obviously for children, it's a, I'll go on record saying it's a very safe vaccine, right? I could debate with you about some of the other ones, but it's a very safe vaccine, been around for a long time and just so important. And if you look at the statistics, it's very similar to the flu. It unimmunized measles kid, if you're near someone who has the measles, 90% of the time, if you're not immunized, you're getting the measles. So, and those measles parties, I've heard that in our community. Well, we used to have measles parties, like chickenpox parties. I'm like, not a good idea. And your kids die from the measles, and adults die from the measles as well. So, very important, and obviously we see it going around. So that's why we're talking. I decided to do some heart health stuff this month because February is Heart Month. And it's just a nationwide health month day, month, obviously, not day. And it was actually started in 1964 by President Lyndon B. Johnson as an opportunity to educate people and ask them to take care of their health. So interesting, I thought.
I comment ironic that he started it and then died of a heart attack.
Me too. I didn't want to add that, but yep, kind of like all those exercise gurus who, you know, yes, I'll do it your way, and then they die of heart attack. So, but the American Heart Association, they have these wonderful handouts, and this is one of many. They're very good. They're heart health, blood pressure, stroke, very good information. So, this one is kind of the warning signs of a heart attack, which we all think about, right? Chest pain, discomfort in your upper body, some shortness of breath. Sweating and nausea can also be involved there, and women get different symptoms. You'll hear some jaw pain, and men can get jaw pain too. You'll hear some left shoulder pain. But one point that was very interesting in here was what to do, and it said call 911. You know, I tend to load people in my car when things happen, so the call 911 had a statistic that, you know, they get there and start treatment. And so if I load you in my car and get to the ER and then we register and then you wait for someone, there's usually an hour gap at least before you can start some treatment. So, except maybe in Hillsdale where we don't have services.
Well,
I
I will,
thought we were gonna add.
I will say that a few years ago, I thought I was having a heart attack. Went in. You tell somebody in the ER department that, they get you right back right
Yeah,
away.
they should.
It turned out it was just pneumonia, you know, breath, but yeah. Yeah, it wasn't.
No registration, I'm having chest pain, they're like, yeah, get out of
Yeah,
here.
they should.
They don't mess around. Say, oh, go have a seat.
Yeah. And then I thought the other statistic was that many people waited when they're having a heart attack. So, and that was about 3 hours, right? So you convince yourself that maybe your chest pain was what you ate for dinner, and maybe you're not really having chest pain, and maybe everybody in your house is sick and that's what you have. And so 3 hours goes by. And I can say that my mom was having some chest pain. My dad was like out rabbit hunting or something. My mom was having some chest pain and he came home and said, "You don't look very well." And I said, "I just feel like something's been sitting on my chest most of the afternoon." He said, "Oh my gosh, I think you might be having a heart attack. Let's go." And she said, "I need to take a shower." I didn't want to take a shower because you weren't here. I was afraid, so she took a shower and she didn't have a heart attack. She had a dead. So she went and took a shower. She would not go to the emergency room without taking a shower. So obviously, 3 hours with your heart having some troubles with oxygen is not a good thing. Same with brain, right? Strokes are that important as well, right? Immediate attention for those things. So what can you do? And we all know these: don't smoke, don't vape, get your blood pressure under control, your weight under control, do some daily activity. Sugar has also been linked to heart attacks. So if you can get your fasting sugar under 100, your A1C under 5.7, that's all hopeful for your heart health. And some of us just have genetics that are not so great as well. So those kind of things we can hopefully talk to our physicians about and try to get under control. But if you get a chance to go to the American Heart Association website, there are some very good handouts, really good for kind of sharing with your your neighbors, etc. I have a little bunko group and we do, because I'm in it, we do a little medical thing at the beginning, like what should I be watching for? So we're gonna do a little marketing this month, especially for women who tend to ignore things a little more than men as well, and tend to have different symptoms, so we just don't think. And that was about all my education for today. So Heart Health Month. Don't listen to Lyndon B. Johnson's.
Yeah.
It's like, it's a good outlook on. Good outlook.
As well, still advise, think you have a heart attack, take a small ad.
Yes.
Any questions for Lucarello? Hearing none, we'll move on. Environmental health.
Good morning, all.
Great.
We're in the grips of getting ready for accreditation. That has been an all-consuming thing right now for both the well and septic side of it. I feel very confident that we're set to go. We're gonna have them come down and look at us. We'll grow from whatever they find and get better. But I have a lot of faith in my staff. So some of the other things we've done, I've had staff attend the MDARD report writing class. It's one of the things that I feel like that's the hardest part of training up a new sanitarian, at least in the food section. Is how do you write a report that paints a picture in time well enough that if it were to go before a judge, they understand what you're talking about. That's tough. So I had worked with the state and begged a little to put a report writing class together, and they did. And so all of our staff have now gone through this report writing class, which I think is absolutely awesome. We have one person attending a accreditation training class today, and we start accreditation on Monday. So that'll be cool to be able to pick her brain about, well, it should be fresh. You can see on my report that there were a ton of new Big Bs. What that is not new construction, but just change of ownership. So Victor Face, who owned quite a few Big Bs in our jurisdiction, sold to his daughter. And so anytime there's a sale or change of ownership, those food licenses are not transferable. So we had to go and do new openings and get that all licensed up for that new owner. So that's what you're seeing there. Same for well and septic, like I said, we're getting ready for accreditation. The exciting thing that I can say now, because I just got buzzed in the middle of the meeting here, that we were able to extend an offer to a type 2 non-community water supply coordinator candidate. They accepted, and their start date is March 9th. So really excited about that. When they do start, I will be sure to have them come in so I can introduce you to them. I'm really looking forward to it. It's going to be a good opportunity to grow, and this person brings some prior permit writing experience from West. So it's going to be good. I'm looking forward to it. But that's what I have in my report, and willing to answer any questions you might have.
It's not that easy to go. I do have.
Okay, I'm swinging a miss. That's all right. Fire away.
Probably a good time to be doing that accreditation, looking at your report for January, those permits and stuff for well and septic are all down because obviously not the time of year to be putting in a well and septic unless you have to.
Yeah, but getting through, I don't know how much frost you guys have over your way, but we've had areas foot and a half, 2.
So with that, where are we at as far as days out from application to issue of a permit? I know we've had in the past, the lower time of year. Are we caught up? Or
we are getting caught up. Yep, absolutely. Right now, I think without getting a text from Kyle or something like that, if we had to look right now, it's a week or less for sure. Not everything. We are catching up on some of the stuff. Backlogs. What happens is projects start, right, and then funding stops, or contractors said they were available and now they're not. So that's lagging, but we try to, those are outliers, we try to push those out. Right now, we're sitting at a week. That is part of our quality improvement plan, and that is that kind of got slowed down a little bit with accreditation. That's gonna be, we should have that wrapped up the week after. And we'll have a really good idea where we're sitting at and how we can get ready for this coming spring. So that we're firing in all cylinders.
I guess that'd be something I'd like, maybe in our next month's report, is where we're at as far as,
Yep.
you know, that after day link application, that issue or something. So, you know, we hear all the time about, you know, how government standing in the way of construction or something. We're a government agency, and we wanna make sure that we get those permits issued as quick as possible, so we can do that economic activity, so.
I agree with you, but I do want to caution that it's a two-way street. You can come in and apply, and if you don't get us everything that we need, we can't do our job.
And that's where, that's not a complete application in that aspect.
Correct. That is not a complete application. That is something else that we're part of the numbers, right? But that is something that does need to be looked at, that, you know, we've got 25 things that are lingering, but of those 25, 12 of them are incomplete, and we're waiting for them to respond. That's tough.
And I guess I would say the study should be based on, once we have a complete application, how long we're then able to do those events. So,
That is part of it. We're looking at all of it. Why is it incomplete? Did we do something wrong? Were we not clear? So we're trying to figure that out too.
Right.
Yes, I'll have it for you.
thank you, sir. Any other questions? Hearing none, moving on. Area 810, Flora.
Good morning, and we're certainly glad that Ashley Ellsworth, our regional aging representative, could join us today. After some very wild, as we all know, winter weather, she has been held up in Lansing for a while, so thanks for joining us. Our annual conflict of interest and disclosure form is a part of the Board of Health packet on page 42, but it's also the original sitting at your places. So if you could sign those before you could leave, disclose any potential or perceived conflicts of interest, we would greatly appreciate that. That will be a part of our submission for our every 2-year contract review that's coming up in mid-March with the Division of Victim Services. It's the last piece that we'll be submitting in advance of our deadline. So I feel really good about that, to get everything uploaded into their SharePoint site. And our staff is ready, as well as Teresa and Rebecca and their teams, to submit everything needed for that programmatic and financial audit. So we're excited about that. We've served nearly 50 folks since the beginning of the year, which is still quite heavy in terms of caseload and issues going on with people in our communities. I led yesterday's interdisciplinary team meeting in St. Joe County and had a great a bit of dialogue with a couple of pivotal staff, including the jail social worker who was very supportive of one of our home health and hospice staff who are out working with people to try to help find placement in a nursing facility. So there's glitches every which way you can cut it in the community, and we're trying really hard to look at those gaps in services and how we can support people that need services where and when they need them. We have secured a venue for the Elder Justice Symposium, so I'm very pleased to report that. We're looking at a date of September 17th for that. It will be likely a 3-hour session, perhaps more, depending on how the course outlines come back from our speakers. But we're hopeful to get 100 individuals, both law enforcement, first responders, and then agency staff, to train them on everything from the red flags of abuse to sort of dementia and cognitive decline, and what that looks like when you're interviewing somebody or when you're interacting with somebody in the community, based on what you're interacting with them for. We really are pleased that the Prosecuting Attorneys Association and the Attorney General's Office have both committed. We're waiting on the dementia practitioner to confirm. So that's really taking shape, and it will be held in Centerville at the Training Center. So we've been checking out the venue for parking, and so we may have to talk with and maybe get some signs printed or something for where folks can park, because We know there's a ball field behind the training center, and so there's got to be adequate parking. It just doesn't look like it from the road, the way that those buildings are situated right there. So we'll have to look at some signage or some sort of flags or balloons or something to allow people that are familiar with the location to know where to go. We're still awaiting our federal notice of award at the Bureau, and Ashley's nodding yes. That's the notice that comes through after a budget bill is passed. As you all know, late January that was passed for the country, basically. And our anticipation is continuation funding for the rest of the fiscal year. So once that notice of award comes to the Bureau, generally it takes a few business days to put those out into the field for our full year statement of grant award. Staffing update, as Rebecca mentioned, we're scheduling and have conducted some interviews for an outreach specialist. And so we're hopeful that will, happen sometime in the month of March. And then we are also training 2 of our existing more tenured staff on the formal person-centered options counseling component of the My Options program. We've done options counseling for many, many years. So we want to put them through the paces of this particular project's training, and they're more than halfway done. So that'll be good. That's how we kind of, you shift tasks and you reassign, and they both stepped up and said, of course, help. And we will be there even after you get a full-time person. So kind of all hands on deck. It's good teamwork. Still remaining busy with calls and walk-ins for My Options. The component that sort of is a companion program is the Senior Medicare Patrol project, which was put out in an RFP broadly, not just put through the My Options grantees for the Medicare counseling program, but they went a different route, and that's okay. We put in for the whole, the max allowable, which was $25,000. It's summarized in the Program Policy and Appeals or Finance Committee's report later in the agenda, but we were just told yesterday afternoon that we were awarded $15,000 because of the timing of this grant year for this particular program. It'll start March 1 and end technically May 31st, but then it's reauthorized or sort of renewed, if you will. So we will likely get upwards of the 25,000. We just don't know the time frame in which that will all hit. So we're revising the budget and still intend to sub-award a portion of that funding as originally discussed with finance to the tune of half of that award. So $2,500 to the St. Joe County Commission on Aging. Branch wants to participate, but they just didn't ask for funding at this time. So we could re-examine that. That may be an opportunity actually to maybe look at that again when they renew with us in the summer. So our request is still as it stands to move forward with the plan and just adjust our budget accordingly. So again, I mentioned the contract review in mid-March. We're ahead of schedule. We all worked really hard to pull those reports, and Jen, as a newer finance team member, had to, walk through a new set of processes, but did so quite quickly, and everything matched as it needed to. So thank you, Jen, for your work on that. And our contract and planning and cycle is really starting to initiate. We have a 2027 through a 2029 3-year contract cycle coming up. So the RFP will go out, bids will be due in the summer, and the planning document, including all the public hearings and research and community needs assessment information, will be gathered, and all of those tools and all of that timeline is being developed as we speak. So I'm hoping by the March or April Board of Health meeting to give you a bunch of save the dates and all those types of things, so that as a program policy and appeals member, sort of when some of those meetings will be scheduled this summer. And it's going to be a fun year. So thank you in advance for your participation. Any questions?
Any questions for Laura? And again, you know, all the secret copy of the conflict of interest disclosure form there, if you would make sure to get that signed and turned in to Laura later today. The only question I have is, serving on the Wildlife Board, do I have a conflict? Bring the two agencies for the options conflict.
My options project is completely separate between Hillsdale County and Branch and St. Joe, so you should be all set, sir.
That's my, anything else?
And isn't that wild?
It just dawned.
Little things.
Moving forward, the health and disease prevention.
Yeah, so Heidi's up at the MMA workouts today as well. I would simply point out that we are going to have what's called the WIC-MD Management Evaluation in March, or I'm sorry, in April. So we're having accreditation in March, and then we do the WIC-ME in April. And those happen every 2 years, whereas our Michigan Public Health Accreditation happens every 3 years. This year they just haven't out there. Senior. Are there any questions about Heidi's report? I can certainly take it back to her. Good job.
Very good education, let's get it.
Testing is good. You don't know if you don't test.
Any other questions regarding Eddie's report? Hearing none. Health education and promotion.
Good morning.
Morning.
The report is in your packet and I'll just highlight a couple of things. So we've expanded our outreach for the Office of Highway Safety Planning Program into Waldron and Quincy. And we actually have a meeting coming up this next weekend with the reading community in Hillsdale County. On the 24th of January, we participated in a safety day that was organized by the Montgomery Fire Department in Hillsdale County. There were over 200 community members that attended that event. It was amazing. And so we were able to get out some information and we talked to a lot of people and just had some really good conversation. I believe that the fire department may try to do something again in the summer because it was so bitter cold and they were hoping to have trucks there so that the kiddos could get on the trucks and see all that, but it was just so cold. I was really surprised with the turnout for as cold as it was that day, but we have hit the submit button yesterday on our 2027 application to the Office of Highway Safety Planning. We've also been providing some technical assistance. There were some additional organizations across the state who have Amish population who were looking to apply for a similar funding grant. And so we were able to provide some technical assistance to those organizations. And we have been invited to do presentation at the Michigan Drivers Education Teachers Association meeting in April. So we will present our project and encourage drivers education, educate teachers to utilize our vulnerable roadway user information and try to get some information into courses and classes across the state around safety when driving around Amish buggies and horses. Lock It Up campaign is going to be starting soon. We just got our final contract this past week. And so now we're ready to begin the process of putting up that information. We finalized our partnerships with our sensories, public health partners, sheriff's departments to be points of distribution again for us for those secure storage bags. So we'll be promoting that information. We are working on an asset mapping project in Hillsdale County for substance use disorder services. And so that project has just started. And the final goal with that project is to create some type of an online resource tool and a resource guide to help residents within Hillsdale County who may have needs for support and services in the substance use recovery area. As everyone else, we are preparing for accreditation as well, and the annual all-staff meeting that's on April 24th. And so we are keeping moving. The community health worker program, Rachel Baker has finalized everything she needed to do to certify as a community health worker in the state of Michigan, and she is currently working with Covered Bridge Healthcare 2 days a week. And then she is in our office in Three Rivers on the third day. Our full-time community health worker is currently on a medical leave, but we do anticipate her return. Continued areas of concern in the community, of course, is assistance with doing Department of Human Services applications. We refer to many community partners for financial assistance, housing, shelter, education. And then we've been assisting some folks with Social Security applications for not only retirement benefits, but disability benefits. And again, just trying to support people who are home, who are currently unhoused or at risk. That is my report.
Any questions for?
So the 2027 application for the Office of Highway Safety Planning, is that a continuation of already doing new grant requests?
It is a continuation of the services that we currently provide.
So we'll center around the Amish.
It'll center around education of the motoring community, around being safe when driving in our communities, because we do have an Amish population. And it will also continue to work with all of our relationships across the 3 counties to continue to move forward issues around road safety. And we'll be talking with road commissions. We may be talking with townships about how can we create a better road environment that promotes that safety as well.
Okay. Yeah, well, primarily what we hear about is the Amish. Usually could happen there, but it sounds like it's that.
Yeah, so we always have a component of how do we also educate and inform the non-Amish community around their responsibility as being a bigger vehicle with more horsepower and speed. So I was just at Citgo here in Fullwater the other morning, and the 30-second video came on about, driving safely. We've got scheduled some presentations at community groups. We continue, as I said, we have this presentation with the Drivers Education Teachers Association, but we also reach out to the Drivers Ed programs locally to encourage them to continue to use that information when they're doing the vulnerable roadway user segment of the driver's education training. So we continue to find opportunities to not only address, we're trying to address safety as a whole thing again. And then as we did last year, taking the information that we gather from our survey tool that we use within the Amish community to the road commissions to say, this is what the community is telling us as concerns. And then, like I said, we can also take that to the township level as well and just share with the townships that, these are areas of concern. So the proposal is always to do a broad-based, we're not just focused Amish community. We're trying to educate the entire community about how do we share our roads safely.
Yeah, so I was trying to get a sense for is how what we hear a lot about is just short, right? I understand that, but the threat there, of course. But just trying to get a sense of how much of that is dedicated to that specifically versus general safety.
Yeah, so this grant really is focused at that safety between the horse and buggy and the motoring
Okay.
population.
That's
Yes.
I have noticed in St. Joseph County at night, in particular, Amish buggies are lit a lot more than they used to. So we're making some, at least in the county.
Thank you.
Speaking of that, did we ever replace Josh?
Yes, AJ Demond has replaced Josh. He joined our team mid-December. And so, it's only the end of February. So in 2 months, he's done some amazing work trying to get out into that community. He has visited personally with a good portion of every bishop in communities that we served last year and continue to serve, and the communities that we've been working with this year. So as I said, he's met with Waldron. He's worked with Quincy. They're getting ready to distribute surveys to their population in Quincy, so we can get some data and information there. We already have data out of Waldron, and he'll meet with the reading area in first week of March, and so we can have some conversation with them. That's an initial preliminary conversation. But he's done some really great work in the 8 weeks, 9, 10 weeks he's been here. So we did not miss a beat. We are continuing on.
You say Waldron, and I'm like, wait a minute, there's really no Amish in our Osceola or.
Well, yeah, that Waldron Osseo area.
They might drive through.
There's more coming, because there's supposedly 20 families moving from.
Yeah.
Well,
So
And then
we'll
moving on.
Yeah, and yeah, we continue to work. I think, some of the encouraging things we've seen as far as in creating a better road environment is that based on some of the feedback, Hillsdale County Road Commission was able to do some resurfacing in Camden Township with a new product that they're testing to see if it will handle the horse traffic a little better. So we've been able to at least share data and information that helps the road commissions and others make good decisions or helps them inform decisions around projects that may need to be done. We got the schools, the Amish schools on Camden Road, it's now painted and has a school sign there. To at least let the community know that there is a school there and they should slow down. So just trying to create an environment in which we can all share the road safely.
Any other questions? All right, no, moving on. Brings us to financial reports, approval of payments. Janet, here, I guess, do we have any questions? Good morning, Jen.
Good morning. Page 33 starts the check register for the payments in January. Everything was pretty normal. 2 to kind of mention at the top, accent quick printing for $1,250. That is a payment for manuals for the horse and buggy drivers. That was just mentioned. And on the second page, there's a $2,500 payment to Maynard Custodian. That is a partial audit payment. Do you have any other questions? I will try to answer them.
Any questions? If not, I would entertain a motion to approve the payment as presented in January. Support. And motion from Commissioner Paper for Commissioner Collins to approve the payment as presented. Any further discussion? Hearing none, all those in favor say aye. Aye. All opposed, motion carried. Next is the financial statement for month ending January 31st, 2026.
Starting on page 36, we have a balance sheet that shows balance. We also have the cash receipts and disbursements, and then followed by the expenses by RU. Currently at 4 months in, all programs should be expended at 33.33%, except for the 9-month programs, which would be at 44.44%. The agency overall is under budget right now at 1.66. Are there any questions?
Financial statement as presented.
I make a motion, we approve the financial statements as.
Motion from Commissioner Hoffmeister, support from. Well, it was so soft over there.
Yeah. Sorry about that.
To approve the month end financial statement as presented. Any further discussion? Hearing none, all those in favor say aye.
Aye.
Carried. Brings us Committee report, starting on page 40, Finance Committee, Commissioner.
Being the illustrious chair of the Finance Committee, I will bring the report you have in front of you. We went over many of the items on new business. But had a good committee meeting. We were in on there in no time, so.
Do I have motion for
Gonna
the
move.
Finance Committee report?
Thanks, Joe.
Thank
Support that.
Thank
So-
you.
so political.
you.
Thank you. The only thing I would say is in the heading where it says Board of 3 Health,
Well, you want to make sure that you knew that all three of us were there. It's a rarity.
So I have motion from Commissioner Howell, support from Commissioner Stoll to approve the Finance Committee meeting minutes as presented with that like correction there in the heading. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. That brings us to the Oregon Policy and Appeal Committee meeting and
Yes, we had a meeting and, we did discuss a few issues that are also in business. See, one thing that isn't for new business that was brought up was procurement policy, liability coverage limits. It's a future topic to discuss further about that.
Open Policy and Appeals Committee report.
support. Vote from Commissioner Schaefer, support because Commissioner Hoffmeister to approve the program policy and appeals committee meeting minutes. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried.
Because you got a date.
Yeah.
You know, Commissioner Lenny's on
Point well made.
Unfinished business, there is none. Number 9, new business. First thing there is already conversed about that, but the Area County Aging Conflict of Interest Statement, and that's included in the packet, but also there's a separate copy for everybody to sign and return. Any other discussion on that item? That brings us to item 9B, the HVAC bids for the Hillsdale office. And in our packet. Hoffmaster, if you want to start this, finance or?
We went over it in finance. Rebecca and Teresa did a great job of kind of bringing this front. They thoroughly went through it. Teresa, I don't know if there's any- or Rebecca, the truth go. Rebecca, is there anything else you wanted to add?
No, we did have some further conversation about, limits of liability, as Mr. Stoll already mentioned, that we'll look to for, potential future projects, but this particular project, the contractor that was selected to, receive the bid at the finance committee meeting is the, R. Johnson Builders.
Be accept R. Johnson.
Support. Have a motion from Commissioner House, support from Commissioner Collins. Commissioner Stoll.
You heard that one.
I did, but I to accept the bid from R. Johnson Builders for the HVAC at the Hillsdale office. Any discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried.
Would you like a roll call, sir? No? Okay.
Next up is the bank account for St. Joseph County deposit.
We also discussed this one level. You have abstained from anything having to do with this, since I do work at Century Bank and Trust.
So we will ask Rebecca to
We'll have Rebecca.
When
and right, I would just because conflict of interest disclosure, I would ask that disclosure from Commissioner Hoffman to be stated in the minutes of this meeting as it's required underneath this statute.
When we opened our office in Three Rivers in 1995, do deposit banking for fees that were accepted for environmental health and other programs through the clinic. So at that time, a depository account was set up with Sturgis Bank and Trust. Century Bank Trust was not in Three Rivers, or at least not close by at that time. So since then, things have changed, and we already do business in Coldwater with Century Bank and Trust. We want to consolidate, have fewer bank accounts open, and we're looking to close the account at Sturgis Bank and Trust and open a depository account at Century Bank and Trust in Three Rivers. Take the place of that. That's really what it is.
Looked over, the only like the reason thing to do. Move our funds.
What do we do for health?
What is the bank we use? Southern Michigan. Well, that is what it is.
The funds in all three places, so I'm wondering why we're not just them on all three.
To do this.
Would be my only comment on that.
Sure. We appreciate our relationship with Century though, I believe. We have longstanding business with them and know those folks really well. Not that, it has to always be on relationships, but we certainly appreciate the relationship we do with the bank. But I hear you, and I will bring it to Teresa's attention.
1995. Was not born.
I'll support the motion.
Motion from Commissioner House or Commissioner to approve the depository change for the Sturgis and Three Rivers office. Is there any further discussion?
I do. This one is like,
And I guess I looked, I think, maybe Southern's branch, they're maybe a little further away than where Century's branch is from one of the, I don't know, but.
We'll look into it.
So you
Because-
are
Because
taking breakfast.
there's exactly what I.
Because there's no Century Bank branch in Hilton, closest Century Bank branch in Hilton County would be in Reading.
I do also, I understand. It's for ease, I guess it is, does make sense. It's all.
Any further discussion? Hearing none, all those in favor of changing the depository, say aye.
Aye.
All those opposed, motion carried. D, senior Medicare goal.
So the finance committee authorized or made a recommendation, as noted in the minutes, to approve the contract for up to 25,000, as outlined in the proposal summary that we shared. Again, it's just a programmatic, probably shift. They had to reduce the award for the current grant year. Then it's likely that we'll get another award in June to carry it out. So we would just make adjustments to the budget as necessary, based on the comments that come through in the eGrants portal for the project.
Have a motion to approve the participation in the senior Medicare. Mr. Hoffman, support Mr. Collins to approve the participation. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. Laura, if you would just make sure that on the prior vote for the bank account that passed 5-0 with Vermont Plant. So clerk, I wouldn't say abstain, but the clerk conflict of interest in that, please.
Okay, yes.
Next is item E, the quality improvement plan, and this came from the program policy skills committee, so Joel, if you want to.
Sure. Yeah, so updating the quality improvement plan, we discussed this, something like that, program policy feels. There were a few minor changes that we recommended. Made and. Sorry, Baker.
Here. Motion by Commissioner Stoll, boardroom. Commissioner Schaefer to approve the quality improvement plan as presented. Any further discussion?
I thought it was well settled.
I want to thank staff for listening to some of those concerns and then put them in that, putting those down up front, beginning. Hearing no further discussion, all those in favor of approving the quality improvement plan as presented, say aye. Aye. All those opposed, motion carried. Next is the cost allocation plan. Again, that was also discussed at the program policy field committee meeting.
Yeah, so several updates to this. We saw a very thorough presentation of a red line. Go along with that, so included for policy as well. So we included that in the packet. Support.
We have more, Mr. Stoll for Mr. Master to approve the cost allocation plan as presented. Stoll indicated there was a red line packet available in the program policy skills committee meeting, but we asked staff to save on the red ink and not print another copy of that for this meeting because it was pretty much all red on those pages. So, and they just included the proposed new policy and the current policy for review. So, any further discussion? Hearing none, all those in favor of approving the cost allocation plan, say aye. Aye. All those opposed, motion carried. That is our new business on our agenda. That brings us up to item number 10, public comment. Any additional public comment?
Unless you just want me to say something.
It's been a while since I've seen you, man. Commissioner comment, item 11. Commissioner comment.
I did get my radon test kit back, my second one that I sent in, it was good.
Was it? Okay.
But I figured out, talking to the post office, not send them out during Christmas.
Santa's taking up a lot of that.
I didn't think of it when I sent it out, and she said,
Mine go back to.
So we talked about this. How it's yours, put yours in face.
I did put mine in face.
Is that space? We had this discussion. I think we were with Madison about this meeting. We were talking about this.
But what, should I put it upstairs?
Yes.
It should be the most little.
This is a finished piece with that.
Oh, yeah, that's correct.
I would just,
Was it above 5? Okay, we can still help you. Just come on in. We'll help you.
Any other comments?
How serious take help?
Yeah.
Well, I did it, and I don't sorry.
Just one comment, and Chris, I have seen some of my social media stuff that I look at. Looks like ads paid for by the Michigan Highway Safety Initiative on the horse-drawn buggy initiative as well, not just out there with DHSJ local on them, but also Michigan Highway Safety Transportation.
And I'd also encourage you, if you haven't had an opportunity, and I can't remember if I linked it, but we now have a webpage dedicated to this program. And so there's some really good information there, and all of the materials that have been developed are also available for people to use, download, look at. We include maps. So please, encourage you to look at it, and if you can, promote the fact that it's out there. It'll be on the website under Health Education and Promotion. And I believe it says Horse and Buggy Safety. And please feel free to look at that and use it wherever you feel it's appropriate.
Comments from commissioners, I'll entertain the motion to adjourn. Or motion from Commissioner Stoll for the town to adjourn. All those in favor say aye.
Aye.